Imagine living your whole life with a health risk hiding in your DNA, something preventable, if only you had known. Today, we're talking about genetic testing. Not science fiction, not something for the elite, but a real accessible tool that can change your life. Genetic testing is no longer just about predicting rare diseases. It's about personalizing your health, your treatment, and even your preventative strategies. Welcome to another Visser podcast. Let's get to it. Today we're going to talk about the foundation. Why genetics? Here's the truth. Treating patients without identifying the genetic cause often leads to treatment failure. Side effects become more likely and secondary conditions get overlooked. Genetic testing changes the game. It tells us why you got sick in the first place, what treatment will work for you or work better for you, which medications should you avoid. That's the power of pharmacogenetics, genetically tailored medicine. Smart drugs, for example, can completely change the course of your cancer treatment. And let's remember, many diseases that we accept as part of normal aging, like chronic inflammation is also something. Some cancers, even neurodegenerative risks, can often be prevented with early genetic insights. So, what should you test? What's the human impact here? And who should consider genetic testing? It's another question, right? Because it's not the first thing on your mind. Usually you're doing your blood tests, you're doing your MRI, CT scan, whatever you need. But genetic testing doesn't even, your physician probably won't bring it up. So, for who is it? Anyone with chronic illness, families with a history of cancer, cardiovascular disease, or neurological conditions, any neurological conditions, couples struggling with infertility, miscarriages, or pregnancy complications, definitely. Children with developmental delays, ADHD, autism, you name it. And even athletes. Yes, sport injuries can sometimes be predicted and prevented with genetics. But honestly, genetic testing is for anyone who wants to live longer and healthier. I like to say, if you want to know your financial future, you see a banker. If you want to know your health future, you should look at your genes. Our genetic makeup is passed down from generation to generation. It's our lineage. It's our ancestors. And sometimes they bear gifts or not. And we have to look at this. And it's only recently that the genetic field has really become practical. It was always seen for rare diseases and something you do when you have genetic disorders. And truthfully said, my family has dealt with genetic disorders. And that's why this is especially attractive to me to talk about this, and it's personal. And not only that, but full disclosure, I'm working with a genetic company, Vera Intergen, which we'll talk about a little bit. That's full disclosure, but I have to bring in this because it is a game changer in health. So what about, what does it do for preventative medicine? Okay, I've told you who should take this, right? Think about this. The birth of a sick child can be prevented. Cancer can be detected before it develops. And even if you're healthy today, you can reduce your risk for tomorrow. Genetics is preventative medicine at its core. It's not just about treating problems. It's about avoiding them entirely. And now we can do this. We have the technology to do it in a lot of cases. And in our modern healthcare system, that's the shift we desperately need, from reactive medicine to proactive medicine. We talk about this a lot. So how can we look at real world experience? Like I said before, Vera Intergen is the company I'm involved in. We're built on the largest rare disease and genetic testing infrastructures in the world. 21,500 genetic tests for more than 8,000 rare diseases have been done. Over 900,000 patient experiences. And 90% of our diagnostic kits are designed in-house. So this is a very unique space we're in. And I mentioned this just to give you a perspective, okay? This means we're not just running cookie cutter panels, looking at, your heritage or, those companies, right? Anyway, that's not it. We can design a test for a single patient. That's precision medicine at the highest level, and that's a lot of times what is needed. So when we look at the future of care, now here is where it gets exciting. Genetic discovery is only one step. The future is integrating those results into daily action. Nutrition tailored to your genes. Exercise based on your muscle fiber profile, right? Medication choices that avoid genetic risks. Even lifestyle recommendations, from fertility to cognitive performance. That's the promise of this new revolution in genetic testing, treating, counseling, turning complex genetic data into actionable daily health solutions delivered virtually and in person. So here's my challenge to you. Don't wait until you're sick. Don't wait until you're in the hospital. Genetic testing is about ownership of your health, right? So if you have family history of illness, if you want to have children, right, and you want the best for them, you don't want to give them the burden of, bad genes or from your past, from your genetic lineage, then this is what you do. Or simply, you want to live your longest, healthiest life, then consider genetic testing, because the future of medicine isn't just in hospitals, pills, or surgeries. The future is in you. It is in your genes. And when you know your genetic blueprint, you can live not by chance, but by choice. Genetic testing is not about fear. It's about empowerment. It's about preventing disease, personalizing treatment, and optimizing health. Here we call it health for human, science for health, AI for life. Because the future of healthcare isn't tomorrow, it's already here, and it starts with you. And this is the thing, I do it. I've done a whole panel, and we're going to talk about this in our next episode and my results. And really, what you're doing is you're protecting the next generations. So I'm doing this test, and whatever comes out with me, just that part, I will have tests on my kids, my brothers, my sister, whatever, family members. Because the probability that they might have it is high. So I want to look, as the head of my family, I want to look at what I bring to the table. Look at what my wife brings to the table. And then together look at, okay, what do we need to test for in our kids? What do we need to test for in our siblings? To make sure they're safe, to make sure that they are protected. And this is really a revolution in genetics. Genetics was kind of, I think, the first experience a lot of you had with genetics was about looking at your heritage or looking at where you came from, or, different companies that have done that. For a long while, the FDA had capped these companies and said, listen, you're not allowed to talk about disease or about cures or about outcomes. But genetic testing is that far now. We can talk about this. We can actually see it, do something about it, change it, change our trajectory. And there's one more thing. When, often when you hear influencers, medical physicians, anyone talk about genetics, we always talk about, genetics is like 25%, at best 30%. 70% is epigenetics, is lifestyle, is what you can do about it. However, there are certain things that, if found genetically, they are much more than that. They could really tip the scale. And so that's where we have to really jump in and do something about it. And in our next episode, I'm going to be talking about one of those things, my personal experience with genetics. Thank you. See you soon. And I know this is the basics, but we got to go through the basics to get to the next step. All right, take care.